Thank you all for waiting. As the scheduled time has arrived, we will now begin the briefing on Fujitsu Uvance's new initiatives in the healthcare sector. Please allow me to introduce today's program. First, Ms. Otsuka, Executive Vice President of Fujitsu Limited, will provide an overview of Fujitsu Uvance's new initiatives in the healthcare domain. Next, Mr. Araki, head of our Healthy Living Division, will explain the specific details of these initiatives together with Mr. Takeshi Izaki of Nvidia GK, who is supporting us in this area. Following that, Mr. Katsuta from Healthy Living will introduce our healthcare-focused AI agent, and we will then hear remarks from Professor Satoshi Kodera of the University of Tokyo, who supports these initiatives from the perspective of clinical practice. Finally, we will hold a Q&A session. The program is scheduled to conclude around 2 p.m. The session will be moderated by Otomo from the Corporate Communications and IR Office. Now, Ms. Otsuka, the floor is yours. Hello everyone, this is Otsuka. Thank you very much for joining us today for this briefing session on the new initiative in the healthcare sector under Fujitsu Uvance. Fujitsu Uvance aims to realize advanced decision-making through the power of data and AI, striving to achieve both business impact and social impact. The area that Fujitsu Uvance is tackling this time is Japan's healthcare system, which is now facing a sustainability crisis. As you may have seen in the news, Japan's healthcare system is struggling with multiple serious challenges. Healthcare expenditures have been increasing year by year, reaching 47 trillion yen in fiscal year 2023. In fact, about half of healthcare costs go to personnel expenses at medical institutions, and of that, roughly 16%, or around 3 trillion yen, is spent on administrative work. As a result, as many as 75% of medical institutions are running a financial deficit, and excessive workloads for healthcare workers have become the norm. Looking ahead, the situation is expected to worsen due to the increase in the number of patients from a declining birth rate and aging population, coupled with a shortage of healthcare professionals. There are various factors behind these challenges, but our hypothesis is that one of the key drivers is the complex and highly person-dependent nature of healthcare operations, which generates an enormous amount of administrative work. We believe that by simplifying these healthcare operations through the power of data and AI, and freeing healthcare professionals from excessive clerical work, we can transform both the operations and management of medical institutions, ultimately enhancing the sustainability of Japan's healthcare system. To address this, Fujitsu has built a platform that enables the safe and efficient use of AI in the healthcare industry. Mr. Araki will provide more details shortly. Thank you.
Thank you, Ms. Otsuka. Now let's move on to the specific initiatives. Mr. Araki, please. Hello everyone. I am Araki, head of the Healthy Living business. Earlier, Ms. Otsuka talked about the need to free medical professionals from complex and person-dependent medical operations. To achieve this, we need proactive agents that can act on their own initiative without specific instructions to assess situations and perform necessary tasks toward specific goals. These are AI agents. Various AI agents specialized in healthcare will collaborate on a reliable foundation to work toward the sustainability of healthcare delivery systems. Please take a moment to watch the video showcasing a glimpse of the world Fujitsu is striving to create.
持続可能性の危機に瀕する日本の医療が AI エージェントの力であります。富士通はヘルスケアに特化した AI エージェントの実行基盤を構築します。従来、医師や看護師、医療事務などの専門職が行っていた業務は業務特化型 AI エージェントが担います。さらに、司令塔であるオーケストレーター AI エージェントの指示のもと、自律的に AI エージェント同士が連携、協働することで各業務の効率化にとどまらない組織全体の最適化が進みます。いずれは病院という施設の枠も超え、より広範、多様な環境に広がり、時間や場所にとらわれない新たな医療提供体制が作られます。例えば、医療現場では AI エージェントが受付、問診、文書作成などの間接業務を代行することで、医療従事者がより診療や患者ケアに専念できるようになります。医療機関では間接業務を AI エージェントが担うことで人件費が最適化され、収益性と経営の持続可能性の両立につながります。そして患者は AI エージェントにより医療へのアクセス方法が多様化することで、一人一人の状態や背景に合わせた最適な医療サービスを適切なタイミングで受けられるようになります。AI エージェントが人間のバディとなり、日本医療の未来を開いていきます。
この世界を作るには、
To create this world, we must transform a wide range of business operations. For many years, we have accumulated knowledge about medical business operations in the field of medical information systems and have collaborated with many medical institutions in the process. Based on this knowledge, we will first build a foundation on the Fujitsu Healthy Living Platform or cloud-based platform for healthcare sector that enables the safe and efficient implementation of healthcare-specific AI agents. The platform includes AI agents that handle data structuring and interoperability monitoring, as well as the orchestrator AI agent that supports the coordination of various AI agents and oversees the entire system. By providing this platform to domestic and international partners, we aim to enable the swift social implementation of diverse AI agents, driving broad and rapid transformation of healthcare operations. This infrastructure or foundation which will implement various AI agents is being built with the support of Nvidia Corporation. By combining a business knowledge of medical operations gained through our support of medical information systems in Japan, with the support of Nvidia, a world leader in AI agent foundational technology, we aim to implement the world's most advanced medical operations. Now, we'd like to hear from Mr. Izaki of Nvidia GK about his expectations for this initiative. Mr. Izaki, please.
Good afternoon, everyone. I am Izaki of Nvidia. So today, I would like to talk about sovereign AI and our support for Fujitsu in this initiative. So first of all, what is sovereign AI? Recently, I'm sure you've already heard the term in many different places. A sovereign, of course, has a certain meaning, but by interpreting this, we can say that a sovereign is for a state or for nation, and AI or LLM that is specialized for a state or nation. And we are talking about the necessity to have such sovereign AI. Actually, our CEO, Jason Huan, at the time, 2 years ago, met with the then Prime Minister Kishida, and he talked about the importance of creating sovereign AI for Japan. data is crucial for a nation. We need to make sure that data is fully utilized, and intelligence that comes out of the data should be utilized in a way that contributes to the economy and the nation. And that is why our CEO talked about the importance of the sovereign foundation model. So why do we need this in the first place? Normally, we have the foundational model. Usually, this comes out of the North America region or China. That's where these models are developed. This lacks a cultural context in many of the models. This is just a very simple example. Let's say egg dish, egg meal. No one thinks of egg custard or chawanmushi in the Japanese cuisine. So we need to utilize data of Japan to ensure compatibility with the Japanese culture and also ensure there is a wide range of applications available. That is why sovereign foundation model is necessary. Of course, we will use the widely available models. We need to do further adjustments and fine-tuning to create a sovereign foundation model. And of course, this requires sovereign data. We need to make sure this data is updated to reflect the latest data. And this can then be utilized for industry-specific or company-specific or even state-specific applications. We've collaborated for many years with Fujitsu. We started with primary, basically using Nvidia's GP in a server. We also collaborated in the area of supercomputer or in the areas of systems integration. More recently, we are applying our software technology in Fujitsu Business. One such area is the telecommunications. We have software-defined a radio, the vRAN, also uses Nvidia technology, and also Jinlai. This is the AI technology foundation. We've been collaborating on many fronts, and now with Uvance, inside Uvance or Fujitsu Kozuchi, and also Takane, we've provided a significant amount of support to make these solutions possible. And along this initiative, we've seen the emergence of agents. After 2012, we started on this AI journey with the perception AI and ChatGPT in the 2020. And this year, it's said to be the first year in the emergence of agentic AI. So through horizontal collaboration of various AI technology, utilizing tools, agents will utilize tools, and this will bring about a significant change and transformation to industry. And what is ahead is a physical AI. This is where we are headed to. We have a multimodal data or token used to create action tokens, and autonomously they need to make decisions how they should act, and this agentic technology will become crucial. So along this evolution and development, we are starting to work with Fujitsu in the area of healthcare sector, and we are already looking ahead to future collaborations and the kind of world that we can create together. So lastly, I would like to play a video message from Trent Norris, the digital health global business of Nvidia.
And thank you to Fujitsu and the leaders in Japan's healthcare community for your commitment to innovation. For decades, you've stood at the intersection of data, technology, and care, really serving as the digital backbone to Japan's medical system. And now, with cutting-edge agentic AI and collaborations like ours, we have an unparalleled chance to redefine what's possible in healthcare. Health systems are under major strain. Frontline clinicians burdened by hours of note-taking. Administrators challenged to balance cost with care. And our patients are managing increasingly complex care pathways. Our combined efforts to build a better healthcare delivery system are changing that. AI agents are now working alongside doctors and nurses, automating administrative tasks, providing clinical decision support, and even managing patient flow in hospitals. Generative models with agency can now transform unstructured medical records into structured clinical insights, ready for real-time action and care decisions. Together, through this collaboration, we can unlock a future of more efficient hospitals, empowered clinicians, and ultimately better outcomes for all of our patients everywhere. Let's build that future together, Fujitsu. Thank you.
So as you heard, together with Fujitsu, we are here to create a new future. Thank you very much for your attention.
Thank you, Mr. Izaki. Now we will introduce an example of AI agent for healthcare and provide additional technical information. Mr. Katsuta, please. Hello, everyone. I'm Katsuta from Healthy Living. First, as an example of an AI agent for healthcare, please watch a video showing the process from when a patient arrives at the hospital to when the AI agent conducts a medical interview and directs the patient to the appropriate department. An AI agent agrees the patient, conducts a medical interview to determine the necessary information, and directs the patient to the appropriate department. Through conversation with the patient, three AI agents, reception, medical interview, and department diagnosis, work together with an orchestrator AI agent to make comprehensive decisions and proceed autonomously. Hello. How may I help you today? I have a stomachache. You have a stomachache, I see. May I ask you a few questions about your symptoms? Yes, please. When did the pain start? It started yesterday. It started gradually after dinner last night, and it got worse when I woke up this morning. So it started yesterday. Are there any other symptoms you are concerned about? For example, do you have nausea or diarrhea? Have you ever had any serious illness, being hospitalized or undergone surgery? No, I haven't had any serious illnesses. I've never been hospitalized or had surgery. I understand. Thank you for your answers. We will now direct you to the gastroenterology department for an examination. Please wait in the gastroenterology waiting room. Take care. Several AI agents appeared in the video you just saw, but at the core is the orchestrator AI agent, which acts as a command center. The orchestrator AI agent selects the most suitable task-specific AI agent for tasks that require specialized skills such as medical interviews and department classification based on patient data and medical business data. It has an advanced mechanism that performs these tasks autonomously. Additionally, for these AI agents to function properly, the underlying data must be properly organized. This foundation includes data structuring that converts vast amounts of free text data, such as medical records, into a format that can be utilized, compliance measures, including obtaining consent from the user of the use of personal information, security measures to ensure safe use, interoperability to enable data exchange between different systems. These are not simply business system construction skills, but rather the ability to understand the medical work performed by each specialist and to define the relationships between the information handled in each practical situation at a higher level, which only Fujitsu has been able to achieve. In this initiative, the opinions and support of those working in the medical field will be extremely important. So we'd like to so this concludes my explanation. Thank you very much. In this initiative, the opinions and support of those working in the medical field will be extremely important. Here, we'd like to ask Dr. Kodera of University of Tokyo, a leading expert in the application of AI agents in clinical settings, about his expectations for healthcare AI agents. Dr. Kodera, please begin.
Hello, I am Kodera from the Department of Cardiovascular Medicine at the University of Tokyo. In addition to my clinical work in cardiology, I also conduct research on using AI to analyze examinations. And today, I would like to share my expectations for healthcare AI agents after introducing the use of AI that I currently do in my clinical work. So this is the echocardiography. This is utilized to look at the movements of the heart. And this is the kind of echocardiography videos that we need to analyze. After analyzing these videos, we need to put together a report. And by introducing AI into this work, we can create a report from the analysis of these cardiography videos. If there is this kind of AI available, then this can certainly support physicians in putting together the report. We believe this will be highly useful for us clinical practitioners. And also, I would like to introduce our AI for analyzing coronary angiography videos. So coronary angiography is an essential examination for diagnosing this kind of myocardial infarction and angina. And this is the kind of video that is generated black and white. And we need to first develop an AI to get segments of this video. And together with the history of a disease, after the examination, the AI will compile a report. So this is the AI that we developed for this purpose. We believe this AI will also be useful in supporting physicians in our operations. With AI being introduced into clinical fields, of course, UI, user interface, is going to be crucial. And that is why we created this. This is my avatar. It actually moves and also inputs and outputs audio. I myself think this is very well made, but some people say this is a bit creepy. So that is why I'm just showing you the image and not the moving video. But with the introduction of AI into the clinical field, we also need to be creative about the interface. So now I would like to go into the main topic, my expectations for agentic AI. So we cover a wide range of work and operations, and this takes up time, leaving very little time we can spend on patients. So with the help of AI helping us make reports and do administrative work, we can actually free up time to spend on patient care. And I believe this brings benefits not just to clinical practitioners, but also to our patients with more efficiency in our medical operations. This, for example, reduces the waiting time for patients, and this certainly enhances experience of patients. And in the future, we hope that AI agents will be able to do much more work. Then this enables a medicine that is free from time and spatial limitations. On the other hand, there are challenges that we need to recognize. First of all, when it comes to medical field, accuracy is important. If information collected during a patient intake process is erroneous, then of course this can affect subsequent care. And secondly, medical information is personal information, so we need to ensure security. With the introduction of AI agents into the medical field, we also need to review and revise the workflows. This is indeed great technology, but we need to adjust the workflows before introducing this new technology. Otherwise, we could actually increase the workload and burden on the practitioners. And lastly, it is very clear that AI agents are useful, But for us medical practitioners and also patients, we need to also get used to agents and adapt to AI agents. In addition, as the provider of AI agents, what we expect is for the provider to think and come up with a user interface that is easier for patients to accept and also for medical practitioners to have confidence in terms of the user interface and functionality of the agentic AI. So these are some of the challenges that still need to be addressed. By addressing these issues one by one, we hope that agentic AI will be introduced into the medical fields and contribute to improving the healthcare sector of Japan. That's all from me. Thank you very much. Thank you, Professor Onodera.
By the end of this year, we will work with leading medical institutions and solution partners to verify the effectiveness of the healthcare orchestrator AI agent and develop and commercialize specific industry-focused AI agents. This initiative will enable medical professionals to focus on their core tasks such as diagnosis and patient care. Hospital administrators will be able to improve profitability and attract and retain medical professionals by allowing them to concentrate on more essential tasks. Patients will be freed from long waiting times and receive optimal medical services tailored to their individual conditions and backgrounds at the appropriate time. We aim to transform hospital operations and management and ultimately improve the sustainability of healthcare in Japan while realizing a stable healthcare delivery system. This concludes all the presentations, but last year, the three values propositions we announced last year, transforming clinical trial operations in the life sciences field, transforming medical operations in the healthcare field, and establishing governance and management of medical data to realize these transformations, will work in tandem to transform healthcare and drug discovery. Moving forward, under its Fujitsu Uvance business model, Fujitsu will continue to transform healthcare and drug discovery through data and AI, realizing a society where personalized treatment opportunities are available to everyone and advancing the well-being of individuals. Thank you for listening.